Hi guys. So the topic of this presentation, as you are watching it under structured evidence-based medicine, to introduce you about structured evidence-based medicine and how this structured evidence-based medicine will be utilized in this particular unit. So most of you may have an idea of what evidence-based medicine is. So evidence-based medicine is basically whatever best research evidence is available from the literature and what your clinical expertise or clinical experience tells you about managing that particular part or that particular disease in a patient, and then marrying it very nicely with patient values. So you need to basically make conscious decision, a very thoughtful decision about patient care, which not only consider the best available evidence in literature, but also taking into account individual patient values interpreted within your clinical expertise to make a useful recommendation or make a relevant decision for patient care. And that's all is the combination of all these three elements is basically evidence-based medicine. There are few steps in evidence-based medicine. So let me enlarge it for the ease of looking at it. So basically we formulate a searchable question, we search the literature efficiently, we appraise the literature to see if what we are suggesting is worth the value, and then we apply it to clinical practice. But we also want to look at what are the outcomes in our real practice. Now, most of us who are working in the field for a long time, um, it's really well, if you are a pharmacist and working it for a long time, most of the pharmacy practice is quite evidence-based because you focus on things related to evidence, and ideally it should be evidence-based. It should really be up to date based on what is available in literature, or rather, I have a opposite view on it, that, or like not completely opposite but contrasting view, that it should not be against evidence-based medicine. So your practice should not be like, you are going in east direction while the whole evidence is going in west direction. So a little bit here and there modification because of patient's value and patient characteristics is fine, is actually more desirable, but you cannot just refute the evidence altogether. Now, the structured evidence-based medicine approach, or the PICO approach, has been labeled by a lot of expert in the evidence-based medicine field, is is to basically give you a thought process that is going on in evidence-based medicine practice. So people who are practicing EBM for a while, they do it seamlessly. So they don't need to think about it before doing it. But if you are a student or if you are new to evidence-based medicine, the structure-based approach is very nice. A structure-based approach is also quite useful in focusing a particular aspect of the problem. So it's very good to divide your clinical issue into manageable, small issues at a micro level that you can focus on, that you can work on and achieve a particular outcome. So PICO, P is for patient or problem, I is for intervention, C is for comparison, and O is for outcome. I do have quite a good feedback from students about that PICO approach really provide them with perspective, and I'm more than happy to have your input into it. In fact, I'm just waiting on final ethics approval of a project which is going to assess your attitude and confidence towards structured evidence-based approach. Um, as a research project, and you'll be asked to participate in it. And I'll be very grateful if you consider that if you consider to participate in the research project. It's going to provide us a very useful set of information to see whether our strategies are working in achieving the overall outcome for the course and unit. So let's do an example case, and I'll go through with this example case throughout so that I can actually like relate it to you. And basically it's just one of the case in your practice cases. So the reason I'm putting this case as an example is you can see that how we can approach this. So this is, I think, about case 3 or case 2 in your section. I can't really remember at this point in time, but basically it's about a patient who is chronic liver disease patient having an acute flare up, obviously over time, not just overnight, and basically has massive ascites, and doctors are planning to remove the ascites through ascitic tap. And he kind of recalls seeing albumin being used for this indication, but he doesn't know exactly how much to give, and he just wants to know if you can find out more about it and give him a recommendation. They are planning to take out about 10 liters of acidic fluid. So now P for this case, so if you have to define this patient, there are so many ways you can define this patient. But on purpose, I did not put an age information into it. But if age information or gender information is available to you, then it's really important to acknowledge that in your patient population. So basically, is a chronic liver disease patient in liver failure needing the draining of ascites. That's like a common description of this patient. Um, if you look at chronic liver disease patient, basically what I'm trying to tell you here is that the patients can be need to be very specific. The problem need to be very specific because you are going to use this in order to define your PICO table and define your searchable question so that you can go to Medline or PubMed to identify specific references to give a recommendation on that. So cirrhotic patient or patient with cirrhosis on the background of CLD is another good thing to looking into it, because basically if you look at it, you don't have significant massive ascites unless you have reached to that cirrhotic stage or advanced liver failure stage within your chronic liver disease spectrum. They are exception to the rule, but most of the patient will be towards the advanced liver disease. Cirrhotic patient on the background of CLD in acute exacerbation needing urgent ascitic tap with the removal of around 10 liters of ascitic fluid. Now, this is important information. So try to understand that P needs to be very summarized, specific, but it does not need to be massive. So you don't have to copy and paste everything that I've given in case in under the patient section or P section. You need to be very selective that you are putting only information which is relevant to the case and will provide some kind of information to you in terms of your searchable question and looking into like how you are going to approach this problem. So cirrhotic patient cirrhosis stage or end stage liver disease or advanced liver failure, you can replace it with the advanced liver disease patient. Uh, don't have to then say on the background of chronic liver disease because it's an advanced chronic liver disease patient requiring urgent ascitic tap uh, with large volume of acidic fluid removal. Now, why it is important? Because the amount of volume is important. Because it tells you that how much fluid will be replaced or which will be removed from this patient requiring replacement. So the volume is important. Um, it's really important for you to have a PICO, and the PICO, PICO is an iterative process. So you may go to literature and you can come back and say, look, I can better design my PICO now. So you don't have to religiously stick to a P before you go to I and then C and then O and then do a literature search and you cannot go back. No, you can go back. It's not like a didactic exam. It's like not you have to come up with an answer within 15 minutes or 10 minutes. So you can make iterative changes to the P and I and C and O as you become knowledgeable about this topic. And that's why in the learning need or learning expectation section and introduction to the brief structure of this unit, I've explained you that why it is important that you read about the subject, you read about the topic, at least one paper or at least one chapter or at least one piece of information before you attempt these cases, because then you are more aware of what you're dealing with. Now, intervention in this case is albumin. Now, intervention is not like P. So you are most of the time you will have a very specific intervention. You just deal with one intervention. You can't just go and include everything in your intervention, because then how you're going to search it? So are you going to search for all these options? No, you can't do that. So in this one, if you use anything other than albumin, it's just simply wrong. So there is sometimes right and wrong even in these kind of cases. And using anything other than albumin is like, you cannot justify that. Now, comparison, yes, comparison can be very tricky because comparison can be many or can be quite different. And it's basically up to you that how you want to do your comparison. I would recommend against going into multiple comparison, because then how you're going to go and do the search and then select limited number of papers to produce your answer. You can't just compare everything with albumin. You don't have, you'll spend ages on your case. So you need to be very selective of your comparison. You can say placebo and something else, because with placebo you are basically just comparing placebo. But you can basically say all I want to know is how good albumin is of its own. So just either albumin or nothing. That's good. You can take that approach, or you can say, well, because you are removing 10 liters from somebody, so you are causing a lot of fluid imbalances. So at least it's not fair to just compare just placebo. I'll say I'll compare placebo and saline, or placebo all crystallite. That's fine. Or you can say that I'll compare with colloidal non-albumin fluid. So I can compare it with heated starch. I can compare with other colloidal agents which are available other than natural albumin, human albumin. I'll going to look into the synthetic colloidal fluids, or you can look into blood. So you can say, okay, I'll say if we have to replace blood. Now with replacing blood, you are again dealing with a lot of um, negative outcomes. Blood have adverse drug reactions. It's quite limited. It's difficult to give if you do not have a good justification. You need to be very sure that you are meeting those requirements for blood, such as hemoglobin level has to be low. Most of the patients will have low hemoglobin because anemia is also related to chronic liver disease, but you cannot just guarantee that every patient is anemic. So you can't just use blood because then it can cause the increased viscosity, increased load of packed blood cells, and then can also cause complication like thrombosis, complications like trolley, transfusion reactions. So you can't just simply choose something. So if you are choosing blood, I would need to see a very good justification from your side that why you are using blood in this case instead of crystalloid or colloid or placebo. Now, if you cannot find any C, so I'm not dealing with only this case. If you cannot find C in other cases, what can you do? Well, you can always use placebo, right? As I told you before, it's a formative process. So if you go with a placebo in your mind into your literature and you find something which is a very good comparison, other people are using it, so well, I didn't think about it. I think I'll be able to do a much better job looking at the criteria of my assessment if I actually go with more. And this will also give you an understanding that basically your overall um, aim is to basically make yourself more knowledgeable in this area. So it's actually a good idea for you to go with a much broader question in literature and then refine your question to learn more. Outcome. Now, outcome often have issues when people try to approach O in PICO. Now, O in PICO cannot be, subjective, generalized, unmeasurable. So you cannot just have an outcome which you cannot quantify. How you are going to quantify the outcome? So you need to have like, mortality is self-explainable, but morbidity, what kind of morbidity? Was it length of stay? Was it a tissue injury, an organ injury, whether it was disability related to disease? How you are going to define complications? So like avoid complications. Yes, very good. To you, it's very specific, but to me, it's not specific. What are complications? Which complications you are talking about? Circulatory collapse, cardiovascular compromise, hypotensive shock. What is the complication in your mind? So you need to be quite specific and measurable when it comes to outcome, because you are going to find that numbers. You are going to show the difference from your literature. So your outcome needs to be very specific. Now, PICO should be interconnected. It should not be like totally different um, from the case. So you cannot just have everything from my case that I've given you as a P. You cannot have the patient from the literature. Like you cannot have Mr. John Smith in randomized controlled trial sitting there just 56-year-old male, type 2 diabetes, blah blah blah, live in Liverpool or live in, Hobart. You can't just have all of that information. So you need to be very specific when it comes to your patient, that you need to keep enough information from your case, but you need to have a patient that is generalizable from your studies, because you are going to find evidence from studies in order to show who the P is. So your P needs to be a searchable P in literature. Your studies should be applicable to your P or your patient. You cannot study competing contrasting intervention in one go, because again I explain you in the intervention section, you do not have time for it. You cannot just summarize your answer if you have so much information in one go. Comparison is really important. Again, do not apply multiple comparison. Uh, an outcome again is need to be very specific, but all of them should actually give you an answerable question. So there is a reason it is called answerable question, right? Because you are going to answer it at the end. If you make it so broad, so unspecific, you won't be able to answer it. In a cirrhotic patient on the background of CLD requiring large volume ascites removal, what is the recommended regimen for albumin? Now that is the question that doctor is asking you. Is this a right question? Yes, there's nothing wrong with this question, because it is implying that albumin is a good option. So all you are going is you are finding a recommended regimen. But unless you see the literature and you are sure that it is actually what you need to do, you can't just go and find out the regimen. That's the most commonly used approach that we see in clinical pharmacy in hospital. Um, so those of you who are from hospital can appreciate that often you have been approached to find out a dose of something. So they have made a decision that this is the treatment for this patient and all they need is to know how to use it. Now, if you know this is the treatment, you should have, if you know from the evidence that this is the treatment, the second part comes with it. Like you cannot get something from the literature, get something from the evidence, and it doesn't tell you how to use it. You can't just have, like, you can't just go to a car showroom, get a car, and then you don't know how to drive it. So it doesn't pass the logical sense that if somebody is asking you about the regimen, if they have looked into this is the regimen, if this is the intervention, they should have regimen with them anyway. So I think in your this particular case is the use of albumin in a cirrhotic patient on the background of CLD requiring large volume ascites removal results in favorable patient outcomes. Or you can define or describe or specify what is mean by favorable patient outcome. And but that's what you need. You need to be at least uh, ready to accept that it may not be the best option for your patient. You can't just assume that yes, albumin is useful and all we need to know how much to use it. So sometimes it's really important in your practice life also, in these cases also, don't just look at the question, ask yourself, is this the treatment of choice, is this the recommended regimen for this patient, before finding out a recommended regimen. So thank you very much for watching. Now what I'm going to do is I'll have other presentation related to other parts of PICO, this assignment, that in the next presentation we are going to talk about how to develop search strategy and how you can search for literature. Uh,